Good afternoon, everybody. This is Ted Dabrowski, and we're coming from the campaign trail. And today is a sad day in Illinois. This morning, Governor Pritzker signed the assisted suicide bill, further expanding a culture of death in Illinois. The bill passed at 3 a.m. on Halloween with a bare minimum of votes to pass it. It passed with little debate and was signed today with no fanfare. A small minority with a lot of power are the ones who want this bill. Illinoisans do not want this bill. Like its expansion of abortion, where Illinois is a travel destination for the procedure, there is no doubt that Illinois will be a travel destination for assisted suicide. Pritzker's made us into the state people come to end life. It's wrong, it's immoral, and it's not compassionate. With me is my running mate, Dr. Carrie Mendoza. In her profession, she meets people near the end of their life. Her perspective and that of others in the medical field were ignored by Democrat politicians. Our lawmakers ignored the compassionate care medicine has developed for those near the end of life. Carrie, please give us your thoughts and comments, please.
Oh, thank you, Ted. Just concurring with you that this is just a super sad day for Illinois. As a physician and practicing emergency medicine for 25 years, it's just sad to have the state sponsor killing. Basically, just terrible. Just if we pull back historically, any governments that have aligned and sponsored medical killing, it always expands into what initially is thought maybe a small group of people, expands larger and larger, capturing people with disabilities, capturing people with mental health issues, all convinced that either they don't want to be a burden or the costs are too much. We know in Oregon, for example, their coverage for cancer patients has decreased. Suicide hotline coverage has decreased. So it all just reinforces a culture of death. And with the mental health crisis going on, to add this as the state saying it's okay to kill yourself is just tragic. And secondly, I want to mention that as a physician who practiced during the opioid crisis, that was entirely created by government entities saying they quote unquote wanted to be more compassionate about treating pain. And so that just got expanded, and we know the devastation from that. And then third, I just want to say that, no doctor knows exactly when someone is going to die unless you're in an acute situation like a cardiac arrest or something that is just you're not able to, restore circulation. But in terms of terminal illnesses, no doctor knows exactly. And so just the fact that in the legislation, it's saying that, when a physician deems a person has 6 months to live is just really a false, line in the legislation. So, with all those issues, I'll just pause there, Ted, and kick it back to you. I know there's a lot to say, but those are just kind of my high level thoughts.
Yeah. Hey, Carrie, you just might want to add a little bit on the palliative care and how far that's come along.
Yeah, thank you for mentioning that. We as physicians, anyone, we don't want people to suffer, but the hospice and palliative care movement has really been a great addition in medicine. And it's very, very robust, and insurance covers it, Medicaid covers it. So we have a framework to help people in this situation. So this bill is solving a problem that really, frankly, doesn't exist because we have palliative care and hospice care to treat patients who are suffering from debilitating and terminal illnesses. And so it begs the question, Governor Pritzker is really pandering to a small group of zealots who are pushing basically, people killing themselves. And that is just not something that the state of Illinois should be part of, or any state.
All right. Well, thank you for that, Carrie. We also have with us Mary Fio Rito, and Mary is the Cardinal Francis George Fellow at the Ethics and Public Policy Committee. She's an attorney, a public speaker, a radio show host, podcast host. and an expert on ethics surrounding human life issues. She's frequently called upon to provide her insight, and we've asked her to join us just on this live stream to give her reaction to this, because it's something that she knows a lot about. So, Mary, thanks for being with us.
Yeah, Ted, thank you for asking me to be part of the conversation today. I'd like to start just by talking about some of the public policy implications here. The fact that Governor Pritzker, and this was pointed out by Mary Ann Ahern at NBC News, signed the bill quietly and privately with no press conference and no one present, that's just more proof to all what we already know, which is there's no public appetite for assisted suicide in the state of Illinois. There really isn't. This is not what most people are, looking to the Illinois General Assembly to be doing, interfering with people who are in very serious, precarious medical situations, and sometimes also, depression and emotional situations, and suggesting suicide to them. No one was asking for this. So, as Carrie points out, this is really a very extreme part, even of the Democratic Party, and in fact, some of the greatest opponents to assisted suicide legislation have been, groups that I think they would self-describe as being more to the left of center, particularly people who work in the disability rights community. So again, the way in which this was done, not just the signing, the actual passing of the bill. This bill was called at 2:55 a.m. on Halloween morning and then voted on 45 minutes later, literally in the dark of night. And policies this important, really life and death, literally policies, shouldn't be called in the middle of the night, debated under the cloak of dark, and then signed when there's no opportunity for the media or outside interest group to be able to ask the governor questions. So it's just kind of more of the same. It is going to create assisted suicide tourism, because we're the only state in the Midwest that now has assisted suicide, in the same way that we have abortion tourism, where we have people coming from other states who are in their third trimester of pregnancy, and they can get an abortion in Illinois, and often taxpayer funded. So just overall, this is, suicide is something we want to discourage. There's been talk about setting up suicide hotlines, particularly for teenagers. We don't want in any way, shape, or form anyone to be able to say something about assisting another person's death as being a good in some way. And we're sending mixed messages to younger, vulnerable people in particular.
Well, Mary, thank you so much for that. And Carrie, thank you. And we'll be putting out a statement later on today, very shortly. This is a very important issue. And thank you for following and watching here. And this is something that we'll obviously want to push to repeal one day. It's certainly a sad day for Illinois. Thank you all for joining, and we'll be in touch.
Thanks.